Hi, folks. It's Marvin Music with MedicareSchool.com, and want to welcome you to tonight's live stream event. Looking forward to sharing with you some important information about Medicare. But before we get started, I would like to remind you that I also will be taking questions. So some of you have questions about your situation with Medicare, or really any general Medicare question you have, or specific, or Social Security as well. I'd be happy to field any of your questions tonight. That's the purpose of this program. We know that some people find themselves in situations where they need to get an answer, and sometimes it's difficult to get a straight and accurate answer. And so we really provide this platform twice every week to make sure that you get your questions answered, so that you can make great Medicare decisions and really come out of that position where you feel like you're confused and maybe overwhelmed. And we really like to clear things up for you and give you the information that you need to make great Medicare decisions. Also, the benefit of being a part of this is you can help others. I know that at this age, because I'm on Medicare, just started in January, but at this age, Medicare is certainly the topic of discussion. People have opinions, and sometimes they're accurate and sometimes not so accurate. So it gives you a chance to really be a good, reliable source of information to your friends, coworkers, family members, so that you can help them as well make great Medicare decisions. I just want to say that if you're our client, we're grateful that we get to serve as your Medicare broker. And if you're not and you're looking for someone to assist you, we'd be delighted to be your broker. Anytime we help people, there's no cost to our services, and we will help people go on Medicare, enroll in Medicare, set up Social Security as well. For folks that are coming into Medicare after age 65, there's some additional paperwork, and we will assist and guide through that whole process. So the point is, everything that you would need on Medicare to get your Medicare set up properly and accurately and on time, that's what our company does. We'd be delighted to do that. And really, anything that we do for you is never a charge. Insurance companies actually pay the agent, so they pay us, not you. And so take advantage of everything that we are willing to do for you. It'd be our privilege to serve you. All right, let's get started. Tonight, we're going to talk about the common problems that occur in Medicare that are also very costly. So these are actually, I want to mention 5 common problems that cost people. People make these mistakes on a daily basis, so we don't want you to do so. I'm going to get into the details of those 5 scenarios. So if you're taking notes, you can jot some things down. But before I do, I think it's real important to lay the foundation as we talk about Medicare enrollment. Important to note, folks, that there's 3 and only 3 enrollment periods for you to get into Medicare. Now, keep in mind, there's also enrollment periods to buy other insurance products. That would be advantage plans, prescription drug plans, and supplemental plans. So when you are looking at enrollment periods, you always have to break those apart because there's 2 separate type of enrollments. One, getting into the Medicare A and B system, and the other set of enrollment periods has to do with getting other insurance. And I'm going to be talking a little bit about both of these, but I want to make sure you differentiate these, because sometimes that's where the confusion comes, because each of these systems, you're getting enrolled into something differently, but they use some of the same terminology, some of the same acronyms, and that's what adds to the confusion. So again, getting into Medicare, we have enrollment periods for that, and then getting other insurance products, we have enrollment periods for that. All right, so let's get into the 3 enrollment periods that allow us to come into Medicare. And so the first one is called the IEP. That's the initial enrollment period. And this is an enrollment period that anyone would use if they're going to start Medicare at 65. Okay. And there are many people that have to start Medicare at 65. If you're no longer working, your spouse isn't, if you're covered by COBRA insurance, TRICARE insurance, small employer plans, 19 or fewer employees, or you're on an ACA plan, you're going to come off of that ACA plan. And in those scenarios, those 5, you're going on Medicare at 65. That is called the initial enrollment period. And it's 7 months. 3 months before you turn 65, the month you turn 65, and then 3 months after. So that is for those starting Medicare at 65. The second enrollment period, we use the acronym SEP, Special Enrollment Period. And this is for anyone and everyone that didn't start Medicare at 65 because they or their spouse were still working and you're covered by a good employer-provided plan. And now you're going to retire in the future. You may be 66, 67, 72, 79, whatever age, but you're beyond 65. You're going to come into Medicare using what's called the special enrollment period for this. So this is for those that start Medicare after 65. I'll tell you a little bit more about that here in just a few minutes. And then The last enrollment period, frankly, is one you wouldn't want to use, but it is available. And this one, we use the acronym GEP, and this stands for the General Enrollment Period. And frankly, this is for people who made a mistake. They either missed their IEP or they missed their SEP. And so now they can only come into Medicare using the General Enrollment Period. They've made a mistake, but they can still get into Medicare, but this one is very limited. All right. And so tonight, with that being said, IEP at 65, SEP after 65, GEP for those that made a mistake. So let's talk about the 5 most common and very costly mistakes that people make as they go on Medicare. And so, by the way, these are not in any order of importance. They're all really, really important. But I'll start here with this one. Those of you that are already receiving Social Security benefits, meaning you got Social Security benefits either through retirement, it could have been spousal benefit, it could have been a survivor benefit, which is typically widow or widower. What happens for anyone that's receiving Social Security benefits, you're going to be automatically enrolled into Medicare A and B, and that A and B will go effective on your 65th birth month. Now, keep in mind, if you're born on the first day of any month, it's going to be the previous month. But my birthday was January 3rd, and I started my Medicare January 1. So the point is we start our Medicare on our birth month, unless you're born on the first, and then that's previous. And so what happens is someone that is approaching 65 has this initial enrollment period, this 7-month window. But if they're already on Social Security, what happens is they're going to be automatically enrolled into Medicare. Medicare uses their IEP, this initial enrollment period, and automatically puts them into Medicare, and their coverage begins again on their 65th birth month. But here is the issue. Even though you're automatically enrolled into Medicare because you're receiving Social Security, it doesn't necessarily mean that you have to stay fully enrolled into Medicare A and B. If you're on Social Security, you have to keep Medicare A, but you don't have to keep B if you or your spouse are still working and you're planning to continue to work and you have a good group plan. You don't have to take Medicare B. And so the mistake is staying in the B of Medicare if you have a good group plan that has 20 employees or more on the payroll. And the reason I'm saying it's a mistake is because your group plan is still going to continue to pay first, and Medicare now is going to pay second. So Medicare in the second payer position is going to cost you minimum this year $202.90 a month. That's the Part B premium, $202.90. It's going to come out of your check, so you may not even think about it, but you're still paying for it. So you've stayed in Medicare B. It's paying second to Medicare. You're paying $203, and it's probably not going to pay very much because if you have a good group plan, Medicare just doesn't pay much. So in my opinion, the reason this is a mistake is because it is a waste of money. What I would do in this scenario, again, you're on A and B automatically because you're on Social Security. The card shows up. You have to have A, but you don't have to have B as long as the group is 20 or more. And so what I would do is I would actually disenroll from Medicare B. And the easy way to do that is to download a form called the Medicare. It's a CMS form called 1763. 1763, and it is your opportunity to disenroll from Part B, which on the form is called medical insurance. And you can pick the date you want to disenroll. I would do it as soon as possible, and I would tell them why, because I have a good group plan through my spouse's employer or through my employer, and I don't need Part B. You'll mail the form in, or fax it in, mail it in, or drop it off at a local Social Security office, and that will then disenroll you from Medicare B. They'll mail you a new card that says Part A only, and then you can pick up a Part B at a later date. To me, it would be a mistake to stay on B if you have a good group plan with Medicare in the second payer position. That's very expensive. All right, that's common mistake number one. Let's talk about number two. Let's say that you are turning 65 and you or your spouse are going to continue to work, and you hear this myth that says that even though you're not going to take Part B, you still have to take Medicare Part A. And if you don't take Part A, you're going to be penalized. Now, folks, that is a myth. That's a misinformation that has been repeated millions of times across our country, and it's totally inaccurate. It's false information. And so, again, let's set the stage. So you're turning 65, you or your spouse are going to continue to work, and you've been told that you have to enroll into Part A, and if you don't, you're going to be penalized. All right. And so the reason that's not, the reason that information is not true is because if Medicare Part A is going to be a zero premium for you. We call this premium free for life. Why would it be zero premium? Because anyone that is paid into the Medicare tax system for at least 40 quarters, we get 4 quarters a year. Therefore, we're talking 10 years. You paid into the Medicare tax system. If you didn't, if you can get those benefits from a spouse or even an ex-spouse or deceased spouse, as long as we have 40 quarters, there will never, ever be a premium for Part A. Part A premium will be zero for life. And if it's zero, there's never a penalty that you'll ever have to pay. And this is why I'm saying it could be a mistake to enroll into A only. Don't enroll because you're going to be penalized, because you're not going to be. But what happens is, if you continue to work, or your spouse is, and you're planning to continue to contribute to a health savings account, and you enroll into A only, you can no longer put any new money into your HSA. Now, the HSA you have is your money, but you can't continue to fund that. And HSAs are wonderful. They're like healthcare IRAs. But again, if you enroll in A only, you can no longer put any new money into your HSA. And so I would much rather just have nothing, no A, no B. You're not going to be penalized as long as A is going to be free, which is 99% of the population. So don't worry about that. Now, listen, if you don't have an HSA and you or your spouse are going to keep working, then I would enroll into A only. It's fine to do so. Again, there's no premium. Medicare A only with a large employer is going to pay second to your group plan, but it sometimes will pay. It doesn't pay deductibles. It doesn't pay co-pays, but it will pay co-insurance. And so I encourage people, as long as you don't have an HSA, I would enroll into A only. And again, it would be the second payer if you had a hospital claim. So what's the mistake? Enrolling into A only because you think you'll be penalized, which you won't be. And you have an HSA, you just shot yourself in the foot because you cannot put any new money into the HSA. Now, I want to clarify something, and I'll go to the next point. Here's this. There are some people that do have a penalty on Part A if they don't take it at 65 or when they retire. And that group of people is 1% of the entire Medicare population, okay? And that is because they don't have 40 quarters paid in the tax system, or they can't get those from a spouse or an ex-spouse. In other words, they have not yet reached the 40 quarters. They better start at 65 or retirement, because if not, then their penalties are going to start adding up. For every year they went without Part A, they will pay a 10% penalty, and they'll pay that double the years they went without. So if they go without Part A, they have a 10% penalty for 1 year, and they'll have to pay it for 2 years. If they go without A for 2 years, it's a 20% penalty, and they pay that for 4 years. And those percentages then are charged to their Part A premiums. So if zero is your premium, there's never a penalty. And so anyone that has 30 to 39 quarters this year, the penalty is $311 a month. Penalty. The premium is $311 a month. So Part A premium, when you got to buy it, is 30 to 39 quarters, $311 a month. If you have 0 to 29 quarters, Daniel's what, $565? I think it's $565 a month if you have 29 quarters or less. And here's the point. The percentage of penalties are added to those premiums. So with 1 year, and I have, say, 35 quarters, I pay 10% on that 311. So the percentage is added to the premium that I have to pay. So if I don't have to pay any premium, I never have to worry about penalties. All right, let's talk about scenario number 3 here, another very common problem. And that's people, and this is really a very, very unfortunate one, as all of them are, but this one's really sad. And that here's what happens. We have somebody that is working, or their spouse is, and they're approaching 65. They have no intention of retiring at all, so they continue to work, and they're covered by an employer-provided plan. But then what happens? Something changes along the way. Let's say they're 67, and they decide to change jobs. Something occurs where they have to change, and they're going to make a transition from one employer to another. And again, they're beyond 65. Let's use the example, they're 67. And so as they make the transition, they're actually going to be without an employer-provided insurance plan for maybe a month or 2, sometimes 3 months. And so what happens is, sometimes in that scenario, people will either go without insurance, or they will just take COBRA insurance. That is a huge mistake, because here's why. Remember earlier when I talked about that one eligible period for starting Medicare after 65? That was the special enrollment period. Special enrollment period is used for those that come into Medicare after 65. But the criteria for eligibility for an SEP is you have to be working, or your spouse has to be working, and we have to prove credible coverage back to your 65th birth month. So you've got to be covered by an employer-provided insurance plan back to 65 with no gaps. And if there's a gap, meaning you have no insurance or you're on COBRA, then you will not qualify for an SEP. I don't want anyone to be afraid of this. I just want you to know that if we don't go on Medicare at 65, we keep working. Just as long as you stay employed and covered by an insurance plan, everything will be fine. So if you happen to be in that position where you're without for a month or 2 or 3 months as you make the transition, all you have to do is to go on Medicare A and B. Okay, because then once you get the employer plan, if that's a better option than your Medicare, you can always drop the Part B and stay enrolled in Part A only. So the point is, the mistake is being in transition after 65 and being covered by COBRA or having no insurance, then you will not be eligible for a special enrollment period, and then you'll be stuck with that third one I mentioned, which is called the general enrollment period, which is only the first quarter of every year, January to March, and you enroll, they start you the next month. So here's what happens. If someone realizes they made a mistake in April or May or thereafter, they can't do anything about it. We have to wait till the following year, till the general enrollment period, which is the first 3 months, to actually enroll into Medicare. All right, so it's a huge mistake. After 65, if you're in transition, go on Medicare. You can always drop it at a later date. All right, so that's the third one. I just have 2 more real quick ones, and that's this. If you're on A and B, and you have some type of a chronic health problem or chronic health problems, or you're concerned about your health situation, meaning you're either starting Medicare at 65 during the initial enrollment period, or you're coming in at 67 and you're using the special enrollment period. What happens when we fully go on Medicare A and B, Medicare has this thing called a Medigap OEP. OEP is an acronym that stands for Open Enrollment Period. So the Medigap OEP is limited. It lasts for only 6 months. And so if you've started Medicare B, either at 65 or later, what happens now, you have this 6-month window where you have an opportunity to get any Medigap policy that you want. Even with serious health conditions, the insurance company has to approve your policy. But again, that's only a 6-month window. And so if you let that 6-month window expire and you have serious health problems, you may possibly never be able to get a Medigap policy for the rest of your life. So what's the mistake? Missing the Medigap OEP. It is tied to your B date, either at 65 or down the road. When that B date begins, now we have 6 months. Now, practically, you don't have to wait till the B begins. You actually can apply in advance. Most people do. Most people apply 3 to 6 months for their Medigap policy, and then it goes into effect when their Part B does. But if you missed it, the prior enrollment, 3 to 6 months before, you still have 6 months of your B date. My B date was January this year, 2026. And so I had all of January, February, March, April, May, and June, 6 months to enroll to any Medigap policy I wanted. Insurance company has to approve my application. They cannot ask me any health questions. They must cover all my pre-existing conditions, meaning I can get that. We call that guaranteed issue. But after that, if I didn't apply and I had health problems, I may never get one, possibly the rest of my life. So don't miss that opportunity. That would be the mistake. And then lastly, I want to talk about those of you that are maybe either you're doing nothing with Medicare because you or your spouse are going to keep working, or maybe you decided to let me go back. Let me give you this one. I think I already told you this one. Okay, I know. Here's the other one I did not mention. I'm very sorry. Got these out of order. So this is someone that is turning 65, and they're covered in one of 3 scenarios. Again, 65th birthday is approaching. Let's say that it's coming up March, and there's 3 scenarios where people make a mistake. And one of those is anyone that's covered by COBRA, anyone that's covered by TRICARE insurance, which is retired military, not VA, but TRICARE, and then those that have a small employer plan. Okay, so those 3 scenarios: COBRA, TRICARE, employer plans where there's 19 or fewer on the payroll. In those 3 scenarios, you must go on Medicare A and B. Why? Because your insurance, COBRA, TRICARE, small employer plans will move automatically to the second payer position when you turn 65. So if you do not enroll in a Medicare at 65 in those 3 scenarios and put Medicare in the first payer position, now you will be responsible to be the first payer. And I promise you, I've seen it multiple times in my career. So again, you're on COBRA, you're on TRICARE, small employer plans, go on Medicare A and B at 65. If you keep those other insurances, and you may decide to do that, then they will pay second to Medicare. And if you don't, you will be the first payer, and they will still only continue to pay in the second position. All right, so those are 5 huge costly mistakes that you don't need to make. Now, again, if you want further clarification, set up an appointment with someone from our office who would be happy to help you further. All right, Daniel, let's talk about our questions tonight. How can we be of help this evening? All right. Here we go. My question is, I'm covered under my significant other's health insurance. Does his insurance count as coverage for me, or will I be penalized if I don't purchase coverage? Yeah. Okay. I understand you're not married. So no, what happens is it is not. Even if you lived in a state where you have like common law marriage, you are going to be required to go on Medicare, because that will not allow you to use an SEP in the future. It has to be somebody that you're actually married to. And we have to prove that with the marriage license. So anyway, so yeah, you're going to need to go on Medicare at 65 for sure. All right. Turning 65 in a few months, working full time, want to work till 67. Good. I have a high deductible health insurance plan at work. $70 deductible, $3,000 max. Good. Should I apply for Medicare? Well, I wouldn't. Is this the second part of the question? What costs more comparing to buy at 60? Okay, we'll go back to the first one for just a minute, Daniel, so I can read that just one more time. Okay, so I'm number one. If you have a high deductible, the question is, do you have an HSA? I would love to know that, because definitely I wouldn't go on Medicare if you had an HSA. I would continue to contribute to that. And so $185 a month. And so Daniel, she's saying that the premium is $185 a month. Okay. That sounds good. Well, I don't think you have a bad health insurance plan at work. I really don't. So I'm going to assume that you're at the base premium of Medicare, which is $202.90 a month, $202.90. I have no idea where you live, but let me just give you something kind of in the Midwest area. Right now, a person can get an in plan. And again, folks, this is just Midwest area. It would be the same in the South and Southeast, Southwest. But an in plan right now is going to be in the neighborhood of about $85 to $90 a month. An in plan is much better than what you have right now. So that's $85 to $90. You're going to have a drug plan. Most people can get one of those for about $10. So we're about $100 in premium, and we have to pay $202.90 for our Medicare Part B. As long if you're single and you're below 109, married couple below 218. So now we're talking about a package here of, let's call it $203, $90 for an in plan. So now we're pushing $295, a drug plan. So you're in the low 300s. So it costs you more money, but you're going to have a much lower deductible, and certainly less max out of pocket. So if you decided to go on Medicare, I do not think that is a mistake. However, if you decide to stay right where you are, especially if you never reach that deductible, okay, then I don't think you're in a bad position. So you're really in one of those where it could go either way, depending upon how much risk you want to assume. I think there's less risk with Medicare, a little bit more money, but again, max out of pocket is going to be less on Medicare. So what I would do, why don't you just call their office, talk to our agents, let them go through exactly the different plans available. G plans right now are going to be a little bit higher, but again, in plan is really a good option. And they'll go through all those with you and make that comparison and really give you the time and get more information from you than what I can get, of course, on the online event. All right. Thanks for the call, though. Let's go. All right. Okay. I've applied for Social Security benefits 90 days ago. I'm expecting spousal benefits. Good. They're still on step 2 of 3. Is this still considered normal time frame? Okay. That's a little long. It really is. What I would do if I were you, Deborah, is I would, why don't you, I go on the Google Maps and search for a local Social Security office to make sure you get a local number. Now, all local numbers are still toll free, but you don't want to call into the main Social Security line. It's sometimes like a 2-hour hold. So again, Google Maps, local Social Security offices are open from 9 to 4, Monday to Friday. And then I would call in and you may have a 15, 20-minute hold time, and that's about it. So ask them what the status of your application is, because 90 is a little much. Now, right now, 30 to 60, not uncommon, but 90 too much. So you need to find out exactly what's going on. Now, they're saying that they're step 2 of 3. That means they've received the application, so it's still in process. But that, again, that's just too long. So please call them and find out where it is. I've had this happen before. We call in and somebody will pull up your file and realize someone's been negligent, been irresponsible, and they'll process it on the spot. I'm not saying that will happen to you, but it could happen to you. But please call local office and get on top of that. All right, next. Okay, so even though I'm covered under my significant other's insurance, does that mean I will have a gap now because Social Security does not recognize his insurance as my coverage? No, not necessarily. As long as you enroll, what? Okay, I turned 65, so May 31st. Okay, what matters though is when you retired. How old you are is not really going to be an issue right now. So what you need to do, um, yeah, December 31st. So she had no coverage then in January. But okay, retired. Okay, you're fine. And let me tell you why you're fine. Because you've missed your IEP, which was May, which would have been May, June, July, August, September. You're now in your SEP, but you're fine because your employer plan ended December 31. So from the date the employment plan ended, you still have 8 months of your SEP. So you're in a fine position. Here's what you're going to do. But in fact, what you ought to do is call our office and have an agent walk you through this. But what they're going to do is we're going to fill out an L564 form for you. We'll get that done. You'll get that. I will email it to you. You'll get that to your HR department, and they're going to verify that you've had employment. And even if it's your spouse's coverage, you should be fine. They'll verify employment, and then what you're going to do is you're going to turn that into the local office, and that's called the SEP enrollment, because SEP enrollment lasts from 8 months from the time you lost that coverage. Okay, and so you really are fine. So do the L564. The CMS 40B, selecting your start date, which is going to have to be 3/1 now that, we're already in February, but you can get a 3/1 start date and there'll be no penalties and there'll be no problems. You just got to walk through the process. So I'd call our office, tell someone why you're calling in. They'll give you an agent and they'll walk you through the process. All right, let's keep going. All right, hell, I'll be 65 in August and we'll start Medicare. My income is $108,000 2024. That's fine. My income for 2025 would be $115,000. How will this reflect an IRMA or not? Think I'll be using your company. Okay, very good. So you turned this August. So you're going to start Medicare this year. They're going to be looking back at 2024. And so you will not have an IRMA for this year, for 2026. So your 2025 income is above the limit. Now, by the way, we don't know what that limit's going to be yet for 2025. That won't come out until later this year. I doubt it's going to bump from 109 to 115. In 2025, it was 106. This year it went to 109, so it bumped up 3,000. So I doubt we're going to see a 6,000 bump up, for next year. So I think what will happen is this: when we go into 2027, they'll look back at 2025, and so if you have a life-changing event, which means you semi-retire or retire, then you will be able to appeal the IRMA. And the agent you talk with or a company will walk you through that process and explain how that works. So my point is, you're not going to have to, for 2026, worry about an IRMA nor an IRMA appeal. But in 2027, you'll want to appeal your IRMA if indeed you either retired in 26 or in 27. You'll be able to appeal and get that IRMA reduced. If your income stays up, then you'll still, of course, have to have an IRMA. It will be a slight IRMA because that's the lowest level IRMA. This year, it's about like $92 for the B and the D IRMA. So I know we don't like IRMAs, but if your income does stay up there, you may have a slight one because of that income at 115. All right, let's keep going. Marvin, I was sell my home before I apply for Medicare. I heard there are penalties to a homeowner that sells their home when they have Medicare. Is that true? What are the penalties? No, not necessarily. And so what we have when it comes to selling a personal residence, and the rules are you've had to own it and live with it within 2 of the last 5 years, and you sell that home at a profit, then there's a certain amount of money that is actually excluded from capital gains. If you're single, that exclusion is $250,000. If you're married, you file a joint return, that exclusion is $500,000. So single 250, married 500, and so that capital gain would not be subject to taxes. Therefore, it would not be reflected on your income for IRMA purposes. And so now, if you're above the 250 or above the 500,000, then yes, that amount would then be reported as capital gains. It would be counted as income, and then that would go into your income calculations to determine your IRMA. Now, again, if you sell it this year, you wouldn't see any effect on that until 2028. And so if you retire in 26 or 27, 27 or 28, then you would still be able to appeal the IRMA, even if the IRMA was caused because of that capital gains being reported on your income tax return. So again, below the exclusion amount, no worry. Above it, it would just be that portion that would be above that would have an impact. All right. Hope that helped. Made sense in my brain. I know sometimes it may not make sense in yours. All right. If I'm automatically enrolled in Medicare and because of Social Security, I have an HSA, am I forced to stop making contributions? Yes. Yeah. You will have to for sure. And then your A date, from that date forward, on the A date, you can put no new money into your HSA. And so if by chance you already have done so, nothing to panic over. What you want to do then is have your accountant make some adjustments, because if you have overfunded it, then you can make an adjustment, and that money that went in pre-tax, you just simply need to pay income taxes on it. The money is fine to stay in your HSA. They're not going to pull it out of there. You'll just have to pay income taxes on that portion that should not have been contributed. That's it. So again, don't panic over. And if you just put in minimal amounts, remember, this year you can put in $5,400 a year, divide that by 12, so you can put in $450 a month. And so just know it's prorated. So let's say my A date is going to be June 1. I was fine to put in money all the way through May, and I could have maxed out. So if you haven't maxed out, it's going to be a non-issue, even if you put in money beyond the A date, because they look at the annual amount that you've put in. And of course, that has to be prorated. All right. So again, once the A date's established, you're taking Social Security, no new money should go in the HSA. If you've overfunded, make the corrections. If you haven't, don't worry about it. All right, let's go. All right, my birthday is July 1959. I will be 66 in 10 months in May, if I'm correct. Okay, let's count it real quick. Let's make sure you are correct. So your birthday's in July. I'm assuming it's 2nd to the 31st. So we got a birthday to July 1959. You got a full retirement age of 66 and 10. So we have that. So July of 2025. And now we're going to count our 10 months. August, September, October, November, December, January, February, March, April, May. Is that what you said? That's exactly right. So May of 2026 is your full retirement age month and year. Good job. Do I have to wait till May to apply for my Social Security? No, you do not. So what's going to happen, you actually can apply anywhere between 3 to 4 months in advance. So if we want to start our benefits in May, you could do it now. It's no problem. And when you're applying, though, what's going to happen, they're going to ask you, when do you want to start your benefits? And here's the question they're going to ask you. Do you want an age-related reduction? Do you want an age-related reduction? And you're going to say no to that. Why? Because that means you're starting early and it's going to reduce it. You don't want to do that. And then they'll say, do you want to start your benefits on May of 2026? And you're going to say yes to that. So you actually get to pick the date you want to start. It'll be on the application for sure. So don't take the age-related reduction. Just say you want to start at full retirement age. The system knows exactly when that is. Of course, May of this year. All right, so you're fine, and you can apply now. That system will open up for you. So just go to ssa.gov and start a new application. Of course, you got to log in with your credentials and start that new application. All right. So that's the way it works. And if you're going to start your Medicare around the same time, I'm not saying you are, but if you are, give us a call and we can actually do all that for you, the Social Security as well as the Medicare, all at the same time. All right. Next question. All right. KC fan. I am too. In fact, I have season tickets. I love to go to the Chiefs games. A lot of fun. All right. So the question is, do you need to have Part B? And the answer is you don't have to have Part B. And there are plenty of federal employees. And by the way, anyone who's not a federal employee, you can never do this. Okay. You have to have FEHB benefits to be able to have A only after you retire. And so what happens, though, is this. when you have A only, then if you have a hospital claim, then Medicare A is going to pay first, and then your secondary insurance is going to pay. Your insurance. You probably have Blue Cross Blue Shield, GEHA. Not sure who you have, but whoever you have is going to pay second on a hospital claim. So Medicare A pays first, then your federal insurance is going to pay second. Now, when it comes to anything that would be normally covered by B, but you don't take B, which is going to be all your outpatient services, all doctor services, even docs that take care of you in the hospital, durable medical equipment, all those kind of things that are covered by B. What will happen with those claims is your GEHA or your Blue Cross, whatever you have, is going to pay first, and now you're going to pay second. All right. And so you'll have deductibles. You could have copays, co-insurance up to the max out of pocket. And so on the B side, you're going to be out of pocket. My opinion is this. I would suggest all people in your scenario go ahead and enroll in A and B. I know it's $203 a month. I've got that. But so you're going to spend $2,400 a month to have Medicare at the first payer position on everything. And then what's going to happen, then your GEHA or your Blue Cross Blue Shield plan is probably going to pay the balance of everything else. So you have almost full coverage for $2,400 a year. To me, that's a much, much better position to be in. It's a whole lot less risk. Okay. Now, another thing. For those people who decide not to take A and they're federal employees, they can still come in at a later date, but you'll be penalized. Even though the federal government says you don't have to have it, you'll still be penalized. So for every 12 months you go without Part B, you'll be assessed a 10% penalty added to your Part B, and that penalty is for life. And the second problem is you can only come into Medicare Part B during now the general enrollment period because you did not take it during your IEP or SEP. So that's another problem. So we got penalties and the coverage is also delayed. So that's why I think people should have A and B. Now, if someone has some serious financial problems, maybe they don't want to do it, but you probably don't have serious financial problems. So I would take it. Another benefit is this. If you have Blue Cross Blue Shield or GEHA, both those companies normally will give you about an $800 a year credit towards your Part B. So we took that $2,400 a year, subtracted 18. Now we're down to about $1,600 a year because the credit you get back. So they're giving you $800 a year because you're putting Medicare in the first payer position. They want you to do that. So I would not do A only if I'm retired from the federal government. I would do A and B for sure, and then have my secondary insurance in the second position on all my claims. All right. Hope that helped. Let's keep going. All right. You mentioned a prescription plan for $10 a month but my mom's is $102 a month. Does the prescription plan vary on medications you're already taking? No. The difference in the premium has to do with the quality or the size of the formulary. I'm on a plan. I live in Missouri. I'm on a plan that's $9.60 a month. That same plan was actually $0 last year, but it's $9.60 a month. I take no meds at all, but it's still a good plan for people that are taking maybe primarily generics, occasionally maybe a brand name or two. Okay. So what happens with these low-cost drug plans is the formulary is about $2,500 meds to choose from. If someone's paying $102 and your mom, I'm assuming she probably either on a Humana plan or a United Healthcare plan, that $102, what's happening is that formula has probably maybe 4,000 meds to choose from. Okay, so my plan, 2,500 meds, $102 premium, probably 4,000 meds. And so if she's on that plan, it could be if someone did their work that she had to be on that plan to get all of her meds in the formulary, because I'd rather pay $100 a month for a drug plan and all my meds be covered than pay $10 and my meds not be covered. Because the beauty of having a broad formulary, if you're taking a lot of meds, is we have a max cap of $2,100 out of pocket for all prescriptions for the entire year. But if a medication you're on is not in formulary, that max cap does not apply. And so it doesn't bother me to pay $100 a month if I needed that because of the meds that I'm taking, no problem. And they don't charge you more for the amount of meds you're using. They charge you more because we have a broader formulary. That's how it works. All right, next. When I was 65, I was unemployed for 3 months. Even though I had COBRA, you recommended that I enroll in A and B. Now I have insurance from my new employer. Should I drop B? Okay, very good. Yes. Here's the rules, David. As long as you have a good group plan at work, you know that it's better coverage, better cost than your Medicare plan. Yes, I would drop B. Second thing is when we want to make sure that that employer has 20 employees on the payroll or more. So it is fine to drop Part B as long as those two criteria: better plan and 20 or more employees. All right. Now, when you drop this and you're going to come back in a later date, let's say you work for 2 more years, then what's going to happen? We got to go back through and back to 65 again, proving that you've had every month covered by an employer provided plan and not COBRA. That's why I had you or advise you, or one of our advisors told you that you had to go on Medicare A and B and not COBRA, because we have to have every single month accounted for all the way back to 65. And it sounds like that's going to happen for you, which is really good. So it's fine to drop group plans. 20 or more, better deal, do it. All right, next. Okay. Well, Diane, yeah, buying a Plan G at 67 is going to have a higher premium than 65. Okay, for sure. But here's the thing. If you took a Plan G right now at 65, that rate is also going to go up. And so, yeah, it's higher when you're older. But again, that's really a non-issue, because I promise you that's if you buy it at 65, in 2 years, it's going to be higher anyways. So yeah, you're going to enter at a higher price, but you would be anyways, even if you took the G plan now, because they will increase for sure. Now, may not be exactly the same, but I promise you, I wouldn't overthink that one. I really would. Decide whether it's best for you to stay on your group plan or to go ahead and go on Medicare. All right, next. All right. Can you have Medicare coverage and have coverage with the VA at the same time? Can one just have VA coverage without Medicare? Okay. So here's the way it works. Yes, you can have both coverages, and let me explain why. You have VA benefits because you or a spouse had actually served in the military. Didn't retire, but you served in the military. And that's what gave you the VA benefits. If someone is not in the military, they couldn't have VA benefits. So that's why you're eligible. Now, Medicare, we're eligible for that because we paid into the Medicare tax system for at least 40 quarters. We pay FICA taxes. We pay self-employment payroll taxes, all those kind of things. We're funding Medicare. And so as long as we have 40 quarters, we're eligible now for Medicare. So two totally different systems. Medicare will not pay the VA, and VA is not going to bill Medicare. They want now VA could bill private health insurance company, but one government agency doesn't bill another government agency. So you don't have to worry about that. Now you're asking, can you just have VA coverage without Medicare? And you can. But here's the issue with that. You want to make sure that you're fully satisfied with the care you're going to get through the VA system, because here's why. What's going to happen then, you're bound to that VA system only. And I know sometimes they'll let you go out of the network and all that kind of thing. But here's what happens. If you down the road decide, I don't like this VA anymore, and now you want to pick up Medicare B at a later date, you can do so. But again, you'll be restricted to the general enrollment period. And for every year you go without B, you're going to have a 10% penalty. Now, let me tell you what I would do if I were in your position, or at least I would say, I hope you'll consider this. What I would do is enroll in Medicare A and B. But when you enroll into insurance, I would get a Medicare Advantage plan. I would. Now, again, I love supplemental plans. I'm on a supplemental plan. I prefer supplemental plans, but there are certain scenarios where Medicare Advantage plans truly make sense. And in your case, this is one of them. Why? Because if I enroll into A and B, now I'm eligible to get what is called a Medicare Advantage only plan, MA only plan, meaning there is no embedded drug coverage as part of the plan. And instead of getting your drugs through your Medicare Advantage, like most people do, you're not going to. You have an MA-only plan. It covers inpatient, outpatient. You're going to get your prescriptions still through the VA. And when you do that, what happens is that Medicare Advantage company will actually give you a credit back towards your Social Security check or reduce your Part B premium substantially. Right now, $100 to $150 a month. So yes, you got to pay $202.90 a month for your Medicare B, but you're going to get a good portion of that back by enrolling into a Medicare Advantage only plan and getting your scripts through the VA. So to me, that makes sense. Plus the perks they offer. Now, in addition, you have a civilian option instead of just the VA only. And most people like to have options. And so that's what I'd recommend doing. Give our office a call. We write those all day long. Happy to see what's available in your market. And some of those may even pay more. I had one the other day. I saw $175 a month credit towards Part B. So that's really pulling the cost of that down substantially. So call our office and let's see what's available in your area. And that may make sense for you. All right, Daniel, who's next? All right, covered under my wife's health insurance. She has an HSA in her name. Good. she contributes the family amount per year. If I go on Medicare, is she limited on how much she can contribute? No. In fact, this is the one exception. In fact, this is kind of a real nuance. Now, if she had Part A, she could not be contributing. But because you have Part A and you're covered by her plan, then she can continue to contribute the family amount, which this year is $8,750 plus $1,000 for you to do catch up. So you can put in $9,750 this year. Okay, so she has nothing, you have A only, but because you're covered by her group plan, they will let you do that. A little nuance, a lot of people are not aware, but that's the way it works. She can continue to do so. So go on A. It's fine to do it, and it will not hurt the HSA at all in that situation. All right, next. What happens if you haven't worked for 44 quarters? I've been a stay-at-home mom for 42 years with only a handful of short terms. Well, here's the thing. If you're presently married and you've been married for 1 year or longer, and your spouse is at least 62, and your spouse has the 40 quarters, not 44, but 40 quarters, 10 years worth of work, then you can draw benefits off that spouse. Let me say it again. Had to be married for a year. We got to prove it with a marriage license. That spouse has to be at least 62 with 40 quarters. You're fine. Now, if you're single, what happens is this. You can draw benefits from an ex-spouse. So if you're divorced, that divorce had to have lasted 10 years. You could not have remarried prior to the age of 60. That spouse has to be at least 62 that you're divorced from. So let me say it again. Ex-spouse, 10 years or longer being married. We got to prove it with a divorce decree. Then you can draw those benefits from an ex-spouse. I'm talking about Medicare benefits. Social Security as well, but there's some little nuances with that. But the point is, you do not have to have your own 40 quarters if you can get it from a spouse or from an ex-spouse. They have to be 62. Divorced, you had to be married 10 years, married still 1 year or longer. All right. Hope that helps. 99% of all people can get their 40 quarters either on their own or from someone else. So I sure hope you can. Call the office if you need help on it. We'll walk you through it. Okay, Marvin, I'm on Medicare A and B with supplemental plan G with Humana. I recently had a stent procedure done. Going to still look for another supplemental plan G. Please advise. Okay. Well, here's the thing. You said recently. Normally, what they're going to ask you, have you had a stent placement in the last 24 months? And if you have, then they'll deny the application. So you can get one in the future, but we need to get beyond that 24-month period. Now, I'm not saying that every company asks that, okay? But I do know some do. So to clarify what you can do, like you got a couple options. One option you have is you can go to, I think what I'll do, let me just give you the best option. Call our office, okay? We have a website that you can kind of navigate through, but let's not go there now. Why don't you just call their office and ask to speak to an agent, and let's see if there's any carrier that does not ask about stent placements. I know some do for sure. Stent placements or stent replacements, actually. But if we can find a carrier that didn't ask that specific question, you still may be able to get it by. So I don't want to be 100% dogmatic that it would be declinable. I think you don't have much of a chance, but again, we write for a lot of carriers. Maybe we could find someone that would take you, and the agent would be happy to go through the health questions to see if we could find a carrier that would. Okay. Hope that helped. If not, you're fine. 2 years later, you'll be able to get it for sure. Pardon me? Oh, okay, good. Okay, my wife turned 65 October 2025. She immediately enrolled in Medicare A. She's also covered by my employer plan. When should she enroll in Part B? Well, if you're going to, first off, if your employer has 19 or fewer, then she needs to get on immediately. But if your employer plan is 20 or more employees on the payroll, and she wants to stay on that plan, she does not have to take Part B until you decide to retire and get off that plan. All right. And so now if you retire and you're underage, you retire, let's say you retire at 62 and your employer continues to cover you, she still then has to go on B, because retiree plans always move to the second payer position for people on Medicare. So be careful with that one. But she does not have to take B until you decide to retire. Or you lose that group plan that you have. Okay. Now, here's the bottom line. If it's costing you $300 a month or more to cover her, then I'd probably go on Medicare. because you can beat the price and definitely the coverage because most group plans are going to have $1,500 to $3,000 deductible. She can get on a G or an N plan, have a much lower deductible and really better coverage. But if you're paying, let's say $250 a month or something, and it's a good plan, then she didn't have to do B yet at all until you get ready to retire. All right, next. All right, that is it. Okay, folks. Well, listen, hey, thanks for the questions tonight. We'll be on again Thursday night. If you know people that could benefit from this, please tell them about our program. We try to do it as long as I'm in the country. I was traveled and did some mission work here recently in India, and so I was gone. But when I'm in the country, we'll always have this on Monday and Thursday nights, 5 o'clock. Tell us about us and about the program so they can learn about Medicare as well. Have a great evening. Thanks so much.